Zabrecky Institute of Biomedicine is kind of the culmination of what we've been attempting to do for the last 40 years. Our paradigm is a little bit different than standard medicine. So instead of symptom relief, it's to really reestablish health. That term is used so broadly that a lot of patients don't understand what they mean, but the term is really homeostasis. Homeostasis is at a happy place where your body's in harmony, it functions appropriately, you live your life in a kind of a joyful way, and you don't succumb to any major disease. There's still a lifespan. Okay, you can be in homeostasis, but you won't die before 85. If you're in homeostasis, the body can continue to function very well up to a maximum lifespan of 126. That's pretty well calculated. It's a couple years off, but the last time Yale did it about 10 years ago, called the Gompertz equation, it says 126 is the maximum lifespan. So life expectancy is much less than that, and many people, when they get to their life expectancy in their mid-70s, they'd like to do better if they could, particularly in our culture now. So we're looking for mechanisms that cause accelerated aging, and we try to restore them back to the normal protective levels. And you can do this through our lifestyle change, the hardest thing to modify. You can do it through elimination of intoxicants. You can do it through taking proper nutrients to restore vital areas of the system. And you can do it by well visits, so the doctor knows what your status is and make the modifications that are necessary. Homeostasis, we'll talk about that for a second. This is controlled by your body. It's way out of the hands of any doctor. There are trillions of reactions that happen every second.
We don't here just treat complex, chronic, rare disorders that are really a function of miscommunications within the human body. We also have here a base of patients who are well, who want to optimize their health. They want to extend the quantity and quality of their years. And we offer them specialized, individualized dietary programs, supplements that are not commercially available, that are specially made to maintain mitochondrial function and brain health. And we also offer IV micronutrients. So all that we're offering the well patient includes all of anti-aging medicine. We cater to athletes of all levels here at the Zabrecky Institute. That includes ultra athletes, runners, swimmers, cyclists. We cater to bodybuilders. We cater to those athletes who engage in competitive sports. We recognize the amount of stress that athletes are putting on their musculoskeletal systems and on their joints. With our IV micronutrient infusions, we restore health to their joints especially, and to the entire musculoskeletal system. What we're doing essentially is we are dramatically decreasing muscle recovery time and dramatically increasing available metabolic energy that the athlete so desperately needs.
I'm Diane Coughlin. I'm a nurse practitioner at Zabrecky Institute of Biomedicine. I've been an RN for 22 years and a nurse practitioner for 8 years. My career spans oncology. I spent 11 years in critical care, 5 years in quality management. I also worked in interventional radiology, and then as a nurse practitioner, I worked in the ER, in emergency medicine, and also in surgery. I love working with patients. It's my favorite thing. That's why I'm in the game. Integrative medicine is a whole new realm. So I learned completely from a medical model. And at this point, my brain's trying to think to the left in understanding and helping to develop the policies with new therapies, vitamin therapies, hydrogen peroxide therapies, ozone therapy, and bringing that forth to the patient and helping them attain wellness without having to take medication.
2 hours he spent. I'm not even a medical student. He spent 2 hours talking to me. And listen to my question.
And Dorothy travels more than 2 hours to get here just to see him and to come in. Because she was diagnosed with myasthenia gravis, and as she said when she was in the hospital, they thought maybe she had a stroke because symptoms are similar, and you have to rule out all the things like that.
Yeah,
And
slurring, swallowing.
Yeah, because the myasthenia gravis is like a muscle weakness, and it can be progressive, and oftentimes, and for Dorothy included, it can affect the muscles like swallowing and speech and so forth. And so she's done a lot of therapies to help improve that. One of the things that occurs in myasthenia gravis is the miscommunication with the receptors. They no longer allow the acetylcholine to work, and so immune therapy, which is what we're offering to Dorothy, actually helps to boost the immune system so that those receptors will actually work the way they're supposed to.
I want to introduce you to our Satori Theracoustic Chair. This is a very important part of our practice. So the idea behind this system is that both halves of your brain should look pretty similar electrically. For most people, that doesn't exist. Stress can cause irregularities, dysregulations in the brain, PTSD, Parkinson's, neurologic disorders, chronic fatigue syndrome, autonomic dysregulations. So we use this system to help ameliorate symptoms of a lot of diseases. For example, in Parkinson's, we can use some of the programs to ameliorate the tremors of Parkinson's. For chronic insomnia, which is one of the biggest problems that patients have who come to use the system, we go into the meditation energy balance program, and we go to grounding and energetic cleansing and tension release. What these programs do is they bring your brain down into a delta wave pattern, which is deeply meditative and calming. The studies have shown that this can calm the brain as much as 10 years of transcendental meditation. So when we go into a program, the patient lies with, will have the headphones, place the headphones on so there's an audio input, and then from the chair itself, there's not an electrical motor, there's a whole vibration system that vibrates at the frequency that your cells in your body vibrate at. So it's a very, very dynamic process. So there's a second accessory part of the chronic insomnia study that we're doing. This tablet was designed by the same engineers that designed the Theracoustic Chair. What the patient does is they take this tablet home with them and they use this to help induce sleep every night. They have to use it at least 4 to 5 times a week because you're training the brain as soon as it hears these audio patterns to go into a deep delta wave state to relax the brain. It's very effective for PTSD because those are the patients who have hypervigilance and a very hard time falling asleep and staying asleep. So you have a couple of options with this tablet. You can do stress relief, and a lot of our patients will use it during the day. You grab a little bit of time for yourself, 8 minutes, 15 minutes, 24 minutes. You can do a guided or a non-guided meditation, brings you right down into a delta wave state. Or for sleep, which is what this is intended for, they simply select the delta sleep and they place the earbuds into their ears. This puts them within a few minutes into sleep. So if you have trouble falling asleep, this puts you into sleep. If you wake up early and you have continual early morning awakening, you can use this 4 or 5 times during the night, puts you right back into sleep. And it's especially good for people who can't tolerate sleep medications and all their side effects. So people love this so much that when they complete the study, they purchase these from us and they continue to use them for months and years.
In the heart disease, you want to do things that are going to increase the energetics in the heart muscle, because if you do that, the patient feels better and has more energy. So they do it with medications, but the medications provide a kind of an artificial forcing of the heart muscle, so it helps at the same time as it hurts, and ultimately the heart as a pump will fail. What you want to do is you want to increase the energetics that you have naturally. And there's products that'll do that. And in severe disease, you have to raise those levels very high in the beginning. And so rather than take them orally, you do it by an infusion. That speeds up the process.
I'm Jean, and I have been suffering from arthritis for many, many years. And I am so fortunate to have found Dr. Hewitt, that she can give me these shots to enable me to live a normal life. I have my knees replaced, my hips replaced, I have my hands operated on. So here I am, walking around, having a good life.
Jean has a severe case of rheumatoid arthritis from which she's been suffering for many years. So we inject her trigger points, which are very much like the fibromyalgia trigger points, with this 5% dextrose solution. It's sugar water. What it does is it irritates the areas locally that we're injecting, and that irritation calls the entire immune system to that area where she's experiencing pain. And the immune system begins to rebuild tissue, connective tissue, cartilage, damaged tendons. So she's experienced a lot of relief getting prolotherapy once a week, and she'll get it for about 3 months, and then her symptoms are gradually resolving. We've noticed since we've been giving her this prolotherapy that she's become much more mobile, her mood has changed. Very important for patients of her age to be as mobile as possible, so without using painkillers and drugs and their negative side effects. Chiropractic didn't work for her. So with these injections, she has found a new, more mobile lifestyle. Prolotherapy has been used for 40 years by the Germans, and it's now being used with some orthopedic surgeons in the area, but we've been doing prolotherapy for a long time. It's very, very effective. We use it in joints, we use it in trigger points, we use it for TMJ, so it has multiple uses, and patients really do very well with it.
I was brought to numerous doctors. They gave me, tried numerous medications, nothing worked. They started sending me to psychologists and decided I had an eating disorder because I didn't really want to eat, because I knew when I ate I'd be in horrible pain. And we had neighbors who had moved up to Ridgefield, Connecticut, and called my mother and said, "We found this great doctor up here. We think you should take Anne." So we drove up there. I remember telling my parents, I was probably 19 years old at the time. I said, this is it. This is the last thing I'm going to try. I was just done. We went up to George. He spent so much time with us. I remember we brought a tape recorder, or a tape to put in his tape recorder, because he had a lot to say, and very quickly. And among other things, he did a lot of testing that people weren't doing at the time.
This developed as when I was very young, just out of chiropractic school. I ended up in Switzerland with some friends. I went there a week early. I was introduced to some doctors in Vevey, which is Switzerland, and they had a clinic. And the old German doctor, who was sandbagging me because he only spoke German until he sat me down at his desk and he spoke English, he said that, and I must have been really young looking. I was like 27 years old. He said, "So you think you're a doctor?" And with all his years of experience, he made me feel like I was an idiot. But he said, I'm going to die pretty soon. And what I did was to treat diseases that you're not going to see. I treated diphtheria and syphilis and all these other diseases, which really aren't going to be a problem in the future. But you're going to have a problem with chronic disease. He says, you're going to need to understand how to deal with chronic disease. And there's 3 things that he's seen, he's noticed over his many years in practice that I'm going to have to look for, and it was poisoning, infection, and malnutrition. He said those are still going to be the 3 major factors that produce aging, accelerated aging in the body. And that's held true. I've constantly looked for other ones, but when we pick a name of a disease like malignancy or cancer, diabetes, heart disease, dementias, they basically all start out as being a poisoning, infection, or malnutrition that went sour or neglected. You don't accelerate through your protective mechanisms unless there's some impediment that's really exhausting your body. So in patients that come in with chronic disorders, particularly the ones that failed standard of care, we gave them the drugs, didn't work. Or there is no standard of care. You've got a disease that we don't have a treatment for because not enough people have it to make it worthwhile for the drug companies to find you a medication. And we deal with those pharmaceutical companies. There's a couple of great ones out there. But they're stuck. They have no way for any level of recovery. And when we evaluate them, we're looking for environmental influences. Did they accumulate toxic metals? Did they accumulate toxic chemicals? They've been on the planet 30, 40, 50 years. The planet's pretty polluted. And it is true some people will still be okay. And I have patients in their 80s that have cholesterol over 450, no heart disease. So the genetics still plays a role in some categories, but it's not as much as they make it sound. But so we evaluate for toxic substances. We evaluate for residual hidden infections. I mean, Lyme certainly brought it to the forefront that you can have a chronic infection that'll slowly debilitate your life, but the organism is still there and they can't eradicate it. So chronic infections, I think, are important. When you look at someone's DNA, 33% of it's viral. So over many millennia, we've accumulated so many viral particles and dealt with them. And although that doesn't give you disease, we still see people coming in with shingles. You know, they caught chickenpox as a kid, now they're ravaged with these neurological pains because their shingles come back because their immune system made a glitch. So these things are recognizable, they're important to understand. And after they get over the acute part of the illness with shingles, you want to go back and take a look at their immune system. So I think as far as reestablishing homeostasis or normalcy in the individual, what we're looking to do is measure for impediments, poisoning, infections, malnutrition, and just support the organism. Just give them what they need to get back to normal functioning. We're constantly pushed off the track. Okay, we can be pushed off the track from emotional issues. We can be pushed off the track because cold temperatures for too long. We can be pushed off the track because we're neglected medically. Physical traumas. So many things can distort you away from homeostasis, but the body tries to regain normalcy. You see a young person with pneumonia totally recover. You see an old person with pneumonia die in a week. Same disease, but the old person has no reserves left because they've used it all up on trivial things as they've gotten older. Now, it could be cigarettes, it could be alcohol, it could be a bad marriage. All these things kind of build up stresses in the body which make you go through your reserves. And it leads into a segue for what is our reserves. They're basically your stem cells in your bone marrow. And you're born with a certain amount, it doesn't change, but it goes down. And once you use up your reserves, you have nothing left, you can't expect to have any repair. So on the death certificates, now they put down complications of old age. Their liver didn't fail, they didn't have dementia, their GI tract was okay, but they still died. So they had no reserves left. So trivial things from the environment just overwhelmed their body. So in a person that's in homeostasis with good reserves, the average age is 85, plus or minus 2 years. That's the average lifespan.
So I'm so proud to be a member of the team here at Zabrecky Institute. I met Dr. Zabrecky, who is a master in biochemistry and immunology. That with my biophysics became a dynamic combination. We knew that together we could get to the heart of the disease process, and using advanced integrative therapies, we could actually make people well.